MS Plus acknowledges the traditional custodians of the land this podcast is recorded on, the Wurundjeri people of the Kulin Nation. We pay our respects to their elders past and present.
This is the MS Boost, the stuff you need to know from the people who know it. Hi everyone and welcome to the MS Boost. So I'm here today with MS nurse Michael Mortensen. Thank you so much for having a chat with me today, Michael. You have been awarded MS Nurse Australasian Association's Lifetime Membership, which is a very special award and very few people, I think a total of maybe 5 people have been awarded this since its inception. Can you tell me a little bit about that?
Well, I think it's 8, actually. I might be number 8 to have received the life membership. So, yeah, that's usually awarded to people who have been around for a while, which I have been, 15 years doing MS nursing. Also for what they consider exceptional service that's been delivered to the MS community, not just to people living with MS, but also to other MS nurses as a mentor, being involved in research and things like that. So, yeah, an overall wrap of spending a good many years dedicated to the area of MS nursing. So it's a big thrill and an absolute huge honour to be given the award for sure.
And we're very lucky to have you. So how did you actually get into MS nursing? And how long have you been an MS nurse in your career?
Well, 15 years actually in working for what started as MS Tasmania, and then MS Tasmania merged with MS Limited, which is now MS Plus in 2016. So sort of like getting to the 50-50 mark now of half of that time with MS Tas and now the second half with MS Plus. But prior to starting in the official MS nurse for Tasmania, I was working in the Royal Hobart Hospital in the ambulatory care area, which is where a lot of MS patients came in to have their infusions. And the lovely nurse who was working there at the time needed an offsider to do clinical trial work. I was interested and she thought we would work well together. So gave me a big push in that direction and said, how about you apply for the position, which I did and successful. And yeah, the rest is history now, Jess.
Wow. And you would have seen, I guess, a lot of changes as well in the MS landscape, with new medications and things like that. What's your sort of experience with that?
Absolutely. Yeah. So whilst I was still in the ambulatory care centre, the first Tysabri infusion was given there. So up until then, there were only the 4 injectable medications. The first Tysabri infusion was done, and also the first 2 clinical trial patients came through on alemtuzumab, Lemtrada. So they were the first of, I think we had 9 participants in the trial here in Hobart. So, and that was the point where I sort of left ambulatory care and moved into the MS nurse position with MS TAS. So it was a weird position where I spent half the time at the hospital working on the clinical trials, supporting the trial nurse, and the other half was actually sitting in at the MS clinic at Royal Hobart Hospital MS clinic, and then the other part of the time was basically case managing clients back in the office in Sandy Bay. So yeah, that was the first of the treatments. The newer treatments, Oratorio trial happened. That was the ocrelizumab trial happened shortly after that as well. And we did the vitamin D trial at the hospital as well. So there were 3 clinical trials going on, as well as educating people with the use of the injectable medications. And then in 2011, that's when the first of the oral medications became available. So I've pretty much been there through the introduction of many of the new drugs, of which I think we're up to about 15 now.
That would be pretty fascinating.
Oh, absolutely, yeah.
And do you see a difference now in, when you see people who are newly diagnosed today as of, say, 15 years ago, just with the options that people have available to them or even keeping their MS sort of under control with medications?
Well, there's certainly back in the day when I started, there was, if people didn't want to go on treatment straight away, they were sort of told to, go away and have a think about it. And, in 12 months' time, when we review you again, if there's a need to start treatment, then we can start the treatment at that point in time. But these days, you'd never be given that option. It's like start early, treat early, get on board. I think we go with that little cat's cry, time matters, and definitely it does. So you don't really find that people are giving that option anymore. And definitely back in the early days, as I said, we had 4 little booklets of all the injectable medications. You would sit down and talk to the patients about each type of them, help them to make that decision about which treatment they would probably best suit their lifestyle. Whereas these
Mhm.
days, I think it's, we can't sit down with 15 booklets and say, these are all your choices. So it's usually driven now by the neurologist to say, look, your MRI scan is reflective of pretty disease burden that warrants going on something a bit stronger. So, and often that's the point too. They start big, hit it hard, and hit it where it hurts. And then, if there's a need later on, then we can sort of wind back the efficacy of the treatment if there's a need to, as it get off the big heavy hitters. But that tends to be the directive these days most of the time is we'll start on the big stuff if there's a need to. We're lucky in Australia where we don't have to go through this escalation process. If someone initial presentation warrants that they need to go on the best drug at the time, then that's the great benefit of living in Australia. As I said, they've got access to that drug right from the get-go rather than having to try something and fail and then go up to the next level and try and fail again until you finally get to the top level. So we can start with the top level here if the neurologists feel it's warranted.
Yeah, absolutely. And so aside from talking to, people about medications, like what other sort of things do you do in your role as an MS nurse? Like what does a day look for you generally?
A lot of symptom management. People will ring in just questioning whether something that they're experiencing is actually MS related or not, or why they're having a flare in their symptoms, tips or tricks that we have to share with them in regard to managing those particular symptoms, sharing websites, fact sheets. MS Australia and MS Plus have got plenty of good webinars and fact sheets that we can share with people, just directing people to reputable websites for which they can really self-manage their disease to a degree if they want to be able to read and learn a little bit more about. Not everyone wants to do that. For those people who are interested in doing their own research, then that's part and parcel of the job as well, is just steering them in the direction of what we would consider to be reputable sites.
Yeah.
Discussing other services that MS Plus has on offer as well, like the employment support program, peer support, and the NDIS services as well. So when people are unsure about those facets of their life, then you can certainly have a good introductory chat and talk about those services. And then if there's a need, make referrals on otherwise.
Yeah, absolutely.
So when the day starts, you never know when the calls come in, what sort of a day you're going to have. Anything
Absolutely.
could happen.
And so being a nurse in Tassie, it's a bit sort of different down there, especially in, people having access to neurologists is maybe a bit more limited and things like that. Like what's your experience being an MS nurse in Tasmania? And do you get to, have relationships where you've been someone's MS nurse for say 10, 15 years?
Oh, absolutely. I've certainly probably know most of the people pre-MS limited time. So when the merge came at 2016, prior to that, I used to sit at the MS clinic. So I would definitely see people coming in all the time, having their neuro reviews at the clinic, and often would be even responsible for organising their infusions through the hospital and things like that. So pre 2016, I still know all of most of those, but yeah, I probably, as I said, I've seen people from when I started in 2009 that have really gone all the way through. They've had babies, that have got married, they've become grandparents, a few that have passed away, unfortunately. But yeah, you really become quite a part of their life when you've been there that long. It's sort of, if they don't know something, oh, Michael will fix it. They just pick up the phone and ring, and I don't mind that. I think you can tailor that service a little bit more to the clients because Tassie's a little bit of a smaller place, obviously, limited by population. But again, as I said, you certainly become quite friendly with there is a nurse at the Royal Hobart Hospital that we work collaboratively together with, and also the neurologist as well. I know all of the neuros, certainly in the south of the state. And as I said, we work quite
Yeah.
collaboratively together. If they need something from me, they'll certainly send me an email. And if I've had a chat with one of their patients that I feel that I need to sort of share that information with them with the consent of the patient, I'll certainly happily send an email to the MS nurse and to the neurologist if required as well. So it's kind of it's a nice, neat
Yeah.
little working relationship that we have between MS Plus office and the hospital and the client, the patients that attend the hospital and the MS clinic.
Yeah.
And not just the neurologists either, OTs and physios as well. the allied
Mhm.
health people as well that hang at the clinic. They work collaboratively with them as well. The continence nurses, physios,
Yep.
OTs, social workers, the whole gamut.
Yep, the whole team. And so is there a bit of a shortage in MS nurses in Tasmania, or is it, how many sort of other MS nurses are in Tassie?
Well, to the best of my knowledge, there's 5 of us down here. I think the MS population is
Wow.
1,000 plus and growing all the time, like
Yep.
everywhere else in Australia, where we're up to 33,000 plus people living with MS. So, as I said, we're only small compared to the mainland, but there's certainly limited by the number of nurses that are available as well. So, myself working for MS Plus, there's another nurse up in the Launceston office who does limited MS nursing work, but there's a nurse at each of the major hospitals then, one down here in Hobart and one in Launceston, or 2 in Launceston, but there's
Yep.
definitely limited access, limited only by the number of hours that people like the Hobart nurses only, works 0.5 position, so she could definitely increase those hours to full-time, and there'd be plenty of work for her to do. So, yeah, we are a little bit lean on the ground, so to speak, and could definitely do with a few
Yeah.
more of us floating around. It would make life a lot easier.
Definitely. And given that there's so few like MS nurses, and even though you're a small population and it sounds like you know a lot of your clients and patients pretty well, has there ever been like a certain client or situation or anything that stands out to you in sort of all your time as an MS nurse?
Probably too many to answer, Jess. I don't know. The joy moments, that there's plenty of those when people, who need services and things and get onto the NDIS. And I assist a lot of people to get onto the NDIS as well. That's also part of my role down here in Tassie, is looking after
Mhm.
those that can do with NDIS services. So, yeah, the successes of people that have done really well by picking up services from the NDIS, physiotherapy or equipment, having houses modified so that it suits their needs. So, and when you run into those people, the great joy of them coming up to you and saying, "Oh, thank you so much." Even something that I've done 5, 6 years ago to get somebody on the NDIS, they say, "You've changed my life by being able to get me onto the program so that they could get the services that are allowing them to live a better life." So they're the ones, the joy moments that I get the most buzz out of, I guess, knowing that you've helped
Yeah.
coordinate a change in that person's quality of life.
That's lovely. Given the fact that you've got this lifetime award now, I have no doubt that you've influenced a lot of people in Tasmania and beyond's lives and to live a bit better. And I guess the other thing that probably stands out to me is that you are in fact a male MS nurse, and maybe, that's not as common in MS nursing. Like, what's your sort of view on it? Do you feel like there's a lack of men in MS nursing, or
There definitely is. When you look at the membership, I think we haven't quite cracked 100 MSNA members, but not every nurse, I guess, out there is as strong as we encourage them to become part of our lovely little membership. When I first started, there was him up in Queensland and myself, and we were it. But over the years, there's certainly been a couple more. I think there is a male MS nurse that works at Royal Melbourne who's not part of MSNA, and I don't know why he never chose to have membership, but probably, yeah. We've just had our conference over in Adelaide 2 months ago, and I'm looking around the room there, and I reckon there's probably about 10 plus male nurses now. So we're slowly moving into that space. I don't know why there aren't more, Jess, to be honest.
yeah,
I mean, it's a great area to work in. I think a lot of males end up in emergency departments and in ICU where the acuity level is a lot higher. And then that's definitely where I
yeah,
started. I was in infectious diseases and oncology. So there was a lot of drive and interest in that space. But I think as you get older, you're trying to hone your skills into a particular knowledge base. And I've chosen MS to be mine. And I thoroughly enjoy working in that space. And I'm glad that I was encouraged to do so by the nurse that was working at the Royal all those 15 years ago. I've never regretted once working in this space. I love it. It's a totally fantastic space to work in, collegiality between all of the other MS nurses from around Australia, not just Australia and New Zealand as well. When we get together, there's always a lot of love in the room, and I think it's just a really niche space to get into, but one that's will always be interesting because there's always change coming through, always new treatments coming, different ways to manage people's symptoms and their disease expectations as well. But yeah, as I said, it's a great space to work in because of the love that you get to share with all of the other people doing the similar work from around the country and New Zealand.
It does sound like quite a sort of a tight community, which is really good, especially when, people with MS sort of needing that support along the way, and you probably having that really sort of continued contact with people is so important.
For sure. As I said, the people at diagnosis, that a lot of the time the nurse seems to be the one that does a lot of the emotional support that gets delivered and navigating the symptomology and stuff like that as well, understanding what the disease is doing. The neurologists simply don't have time to do that. They'll deliver the big bang news, the MRI scan reports and things like that, and they're involved in the treatment decisions when there's a time to change. But beyond that, I think the greatest level of support that the person living with MS usually gets is from their MS nurse. There's not enough of us out there. I know there's a lot of research that's suggesting and supporting the idea that we definitely need to increase the numbers of MS nurses quite significantly across Australia. But the research that's been done clearly supports that those living with MS who have access to an MS nurse do so much better than those who are sort of left out in the wilderness and don't have that level of support that's offered by having regular access to an MS nurse. A nice plug there, but a necessary one, I think, is people, as I said, that the research definitely supports it. It's all about outcomes, I think.
I was going to say, just on that, if you had just one bit of advice or one top tip for a person who's living with MS in all of your experience and time, like what would that sort of be?
Reach out. Just make sure that you do have that connection with somebody that can support you. As a nurse, obviously, you don't have to live with MS to understand the impact that MS has on somebody. For instance, fatigue, which is one of the more significant symptoms that a lot of people living with MS experience. That's one of those hidden symptoms, and a lot of people probably don't understand it unless they live with it. But we can come at it from an empathetic perspective and understanding. As I said, I've heard the stories. I've seen people that understand what it is like for people to go through that most significant symptom. And as I said, I don't have to live it to understand it. And just, I think sometimes it's nice to be able to support people. Just, there might not always be a lot that you can do about it, but having a discussion with somebody to let them know you understand what it is that they're going through, I think it means a lot to people that at least you know what they're talking about. You get it and can sort of support that person. As I said, not always able to as far as symptom management goes, but at least be there as a sounding board. Someone should ring up and have a chat with you and say, this is what's going on. Is this normal? Is this what everybody else goes through when they're living with MS? And just as I said, reassure them that they're experiencing is part and parcel of the disease. And as I said, work towards trying to find strategies to help them to deal with it, to cope with it.
Absolutely. That's really, really good advice. And you can see why that you've been given this award, how much you've contributed to people living with MS and making things a bit better, a bit more manageable for them. Thank you so much, Michael, for speaking with me today. It has been a pleasure.
Absolute pleasure, Jess. No trouble at all. I said, I always warn people when they give that award out, you've got to, you've usually been around for a long time. So I think from most of the recipients of the award have probably moved out of the MS space. I think there's a handful that are still in there. But yeah, I say gift the award, but be careful of what the consequences are, because it usually someone might be getting towards the end of their nursing career and thinking, oh, well, I've got the award. I can just quietly start moving into retirement now, downgrading the hours and starting to think about planning for the future.
Well, we certainly hope not.
I promise I'll stick around for a little bit longer yet.
Excellent, excellent. Very good to hear.
I've got to earn the award now, Jess. I have to earn it.
Thank you so much, Michael.
You're welcome, Jess. Thank you for the opportunity to have this chat with you.
Thanks for listening to the MS Boost.
Check out the show notes for more details, and you can catch up with the new episode of the MS Boost next fortnight.